Right now, over 1.7 million adults in Arizona, many of whom suffer from chronic pain and who are at risk of opioid abuse and addiction, are denied access to chiropractic care. The Arizona Association of Chiropractic has decided that it's time to deal with this matter once and for all.
Hello, I'm Dr. Wayne Bennett, and I'm currently serving as the chairman of the Arizona Association of Chiropractic's Task Force on Access to Access. Our task force hopes you'll pay close attention to the information we're presenting to you here, especially the quote from BJ at the end.
Currently, our nation's spotlight is on the opioids crisis, and for good reason. If you've been paying attention, you know that the Centers for Disease Control, the Federation of State Medical Boards, the Veterans Administration, and even the Food and Drug Administration and others have issued new treatment guidelines calling for reducing opioid prescription. It's important to note that every one of these guidelines also stipulate that the use of non-pharmacological therapies, specifically physical therapy, chiropractic, acupuncture, and massage, be used as frontline treatments in the management of chronic pain. It's also significant to note that the Centers for Disease Control has identified insufficient and punitive insurance coverage and policies as a barrier to these services for chronic pain patients. And last September, in a letter signed by 37 state attorneys general, including Arizona Attorney General Mark Brnovich, the National Association of Attorneys General put the insurance industry on notice that they would be taking necessary and appropriate action to correct this problem.
While these new guidelines are wonderful for our profession, it happens to be the case that in the state of Arizona, over 1.7 million adults, those people who are on the state's Medicaid program called Access, have no chiropractic benefits at all. The leadership of the Arizona Association of Chiropractic has determined that this situation is unacceptable.
Through the efforts of the AAC and its lobby team, the Aaron's Group, on January 8th, Senate Bill 1086 was introduced by Senator Nancy Bartow, the chair of the Senate Health Committee. Co-sponsoring the bill is a powerful bipartisan group of legislators, including 3 other members of the Senate Health Committee, one being Senator Kimberly Yee, who's also the Senate Majority Leader, as well as David Farnsworth, the chair of the Senate Finance Committee, and John Kavanaugh, the chair of Senate Appropriations. 2 days later, over in the House of Representatives, Chairman of the House Health Committee, Representative Heather Carter, introduced House Bill 2135 as a companion bill to Senate Bill 1086. When passed, these bills will bring chiropractic coverage to every man, woman, and child covered by Access, over 1.9 million Arizonans. It's important for you to know that the AAC has taken a firm stance on 2 points relative to this initiative. First, that the full scope of chiropractic practice as defined by Arizona law, including not just adjustments, but also evaluation and management, physical medicine modalities, and imaging, be included as covered benefits. And secondly, that medical necessity for chiropractic care be defined based upon chronic pain guidelines, not acute pain parameters. It's our strong belief that without these 2 requirements, we'll be unable to make the difference that we could in the lives of people suffering from chronic pain and risk of opioid addiction. By now, I hope that you're wondering how you can help, and you can. Here's what we need for you to do. First and foremost, attend the Arizona Chiropractic Legislative Conference at the state capitol on Thursday, February 1st from 8 until 10 in the morning. We need to have a strong showing of doctors at this event. And don't worry if you're not used to talking to legislators about politics. Just your presence, chatting over a hot beverage, and speaking the truth from your heart makes a big difference. If you can attend, please visit the AAC website and register. Second thing you can do is join the AAC if you're not already a member, contribute to the AAC Political Action Fund, or do both. We're already fighting a David versus Goliath battle, and we need funding to make this work. Your membership and PAC contributions do have an impact. To do this, go to the AAC website as well. Finally, the AAC is also collecting testimonials about real experiences associated with both how effective chiropractic management of chronic pain has affected the lives of patients and how chiropractic patients have been adversely impacted by denial of care due to lack of insurance coverage. These stories with real names and faces will help us to make our case when we appear before hearings, talk to stakeholders, and so forth. To provide these, visit the AAC website and go to the bottom right of the home page. If you have any questions, please feel free to call the AAC offices at this number, or if you prefer, here's my personal cell number. If I'm with patients, I promise I'll get back to you as quickly as I can. The leadership of your Arizona Association of Chiropractic believes that we have before us a unique opportunity to positively impact the lives of literally millions of people in our state, and at the same time bring our profession into the mainstream of providers as we battle the opioid epidemic. The time is now, and it's up to us, you and me, to take advantage of this opportunity.
Thank you for listening to this presentation. We think it's important. I look forward to seeing you at the Arizona Association of Chiropractic's Legislative Conference at the state capitol at 8 o'clock in the morning on Thursday, February the 1st. See you there.